It all started when one patient asked her doctor, "When did this happen?" she asked. "Why are the cancer cells growing in my spine?" Her name was Deborah, a mother of two in her early 50s. Years earlier, she had fought breast cancer and survived. But in 2014, she found herself facing a new horror. The cancer had returned and somehow found its way into her spinal fluid, leaving her paralyzed, unable to walk. Her question haunted her physician, who was also a scientist, Dr. Adrienne Boir of Memorial Sloan Kettering Cancer Center. And it set Dr. Boir on a groundbreaking journey, one that's still reshaping what we know about metastatic cancer today. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends, and subscribe. So what is metastasis and how does it occur? Metastasis, when cancer spreads to distant parts of the body, is actually the deadliest feature of cancer. It's not the original tumor that usually kills, but the cancer that resurfaces years later in new, foreign territory. And that's exactly what happened to Deborah. Her breast cancer had managed to migrate to the cerebrospinal fluid, an environment so nutrient poor and hostile for cells. Scientists once thought that no cancer could grow there. So how did cancer cells survive there? And how do any cancer cells complete such a dangerous for them journey? Indeed, most cancer cells never make it. They die trying, ripped apart in bloodstream or starved in unfriendly tissues. And metastasis is incredibly inefficient, but the rare ones that succeed, they're biologically brilliant. They adapt, they reprogram, and in some cases, they prepare the new site in advance, almost like sending an RSVP and asking for the menu. As Dr. Matthew Hayden of MIT puts it, metastasis is an accident, but a remarkably strategic one. Let's talk about one of the mechanisms of how metastasis occurs, namely how fatty acids help cancer spread. What are fatty acids? Fatty acids are a major source of fuel for our cells. They help build cell membranes and provide energy, especially for fast-growing cells like cancer cells. Some tissues, like breast tissue, are naturally rich in fats. So cancer cells that grow there are used to having this easy access to fatty acids. Interestingly, when breast cancer cells travel to the brain, they find themselves in unfamiliar territory. The brain doesn't have the type of fat they're used to, but instead of dying off, the cancer cells adapt by making their own fat to survive. Scientists discovered that if you block this fat-making process in the lab, the cancer cells grow much slower, about half as fast. But this isn't just about the brain. In another study by Dr. Patricia Altia Manzano in Belgium, mice were fed a high-fat diet. That caused a fatty acid called a palmitate to build up in their lungs. When breast cancer cells were injected into these mice, there were twice as much cancer spread to the lungs. Why? Because the cancer cells reprogrammed their mitochondria, their energy centers, to soak up more palmitate. Block that reprogramming and you can slow or even stop the spread of cancer. Now back to Dr. Adrienne Boir's quest to understand how cancer survives in spinal fluid, this barren, clear liquid that surrounds our brain and spine. She and her team examined cancer cells from 5 patients, including Deborah, whose breast or lung cancers had spread to this spine fluid. And they found something stunning. The cancer cells had supercharged their ability to harvest iron, an essential nutrient for cells for growth. They released a protein called lipocaline-2, which captures iron and made a special transporters to suck it back into the cell. Even worse, they outcompeted the local immune cells for iron, leaving the body defenseless. Boir described them as these original jerks of the buffet, grabbing everything before anyone else can eat. To stop them, the team treated mice with deferoxamine, a molecule that steals the iron first, and the result? The mice lived nearly twice as long. That strategy, not killing cancer directly, but starving it by cutting off its supply, is now in early trials in human patients. So what does it all mean? Metastatic cancer isn't just cancer that's spread. It's cancer that's adapted. It's smarter, it's more flexible, and better at surviving under pressure. But now that we understand how it adapts, by stealing iron or altering mitochondria or feeding off fats, we can begin to fight back in new ways. As Dr. Boer says, there are other ways of targeting cancer cells' growth by cutting off what they need to survive. And this is the frontier of cancer research. And it all started with one woman's question: why are the cancer cells growing in my spine? I hope you enjoyed this video. Please like, share, subscribe, and I'm looking forward to reading your comments. Thank you so much for watching. Until next time, bye-bye.